Hi, I'm Bob Schrupp, physical therapist,
Brad Haney, physical therapist.
and together we are the most famous physical therapists on the internet.
Well, in our opinion, of course.
Brad, today we're going to show how to do the barbecue roll. This is a treatment for BPPV when you have it in the horizontal canal. You don't need to know that unless you're a doctor or a physical therapist, the one that's doing the treating. But if you're a patient, they've told you to do this one, and you're supposed to do it to the right, this is how you do it.
BP Vertigo.
Yeah, vertigo.
Okay.
All right.
Okay.
So Brad, why don't you go ahead and lay down. We're going to do the one to the right.
So now if I'm looking to the right, I'm spinning.
Yep, that's where you get the symptoms, and scoot back down a little bit more.
Does my head hang over?
No.
Nope. Okay.
You go ahead and you can support it.
There we go.
All right, what you're going to do is you're going to start with the head turned completely to the right. All right, eyes open for 15 seconds or until the symptoms stop. Okay? After 15 seconds, or if the symptoms stop, now we're going to look just straight up. 15 seconds until the symptoms stop. Eyes still open, right, Brad?
Right. I'm
okay. Now, 15 seconds to the left, or until the symptoms stop.
So we need to go 90 degrees all the way over.
Yeah, all the way over. Mm-hmm. Now you're going to go ahead and roll over onto your, this is the barbecue roll, baby. Roll over onto your stomach. Nope.
To my lap. Okay.
Yeah.
The way my head is turning.
Yeah, the way your head is turning.
Okay.
Head down. 15 seconds. Now that you're going to hear this called the barbecue roll, either the 270 degree or the 360 degree. We're showing you the 270 because we think it's easier. You're not going to roll any further. When after you're done here, and the symptoms should be a lot better by now, you're going to go ahead and get up this way. Show them, Brad.
Come up. Legs go down. Hands are here. And you push up. Take your time. There we go.
Now once you're in this position, you're going to want to stay upright for the rest of the day. We recommend a lot of times people wear a soft collar. If you don't have one, you might take a rolled towel or something and pin it in place to help remind you, because you will need that reminder. You're going to forget.
Right. You cannot look down and you cannot bend over.
Right.
You got to keep
the
that
rest of the day.
level.
Also, since we did it to the right and your symptoms were maybe to the right or to the left, we don't know which way. They might have been both actually. I'd rather have you not lay on your left side or right side when you're sleeping at night. I'd rather just have you keep your head up and maybe use a couple pillows to even elevate you a little bit.
Sure. You can put pillows on each side to remind you not to roll. That can be a little tricky, but that's one thing that can help.
Yep. All right. If you, we're also going to show the video on how to do the barbecue roll to the left on this next video. Good luck.